Welcome back. To complete, or rather to continue our discussion looking at influenza, joining me again, Janice Sheehan, the Manager of Communicable Disease, Tulsa Health Department. Let's jump in.
Okay.
Now, in our first segment, we did talk about sort of the prevalence of influenza and seasonal flu more so than this new novel virus that we're seeing. Let's talk about symptoms. Now, sometimes it's kind of hard to know what are flu symptoms because they can mirror so many things. So as a result, we kind of throw them all together. Talk to me a little bit about flu symptoms, and then we're going to look at what's the difference if in a cold or an allergy. So let's start with flu symptoms.
Well, flu symptoms, unlike an allergies or cold, they come on suddenly, and you suddenly feel very bad. It's not a gradual thing, and your throat usually just be fine 1 minute, and then you have a sore throat. You'll start running a fever. You will have a headache. And the aching follows all that, where your muscles just really hurt. And so those are usually flu symptoms. And you don't get the aching, you don't, with a cold, the first thing, you don't get a sore throat or allergies, either one. And with the allergies or a cold, antihistamines will improve those symptoms. And also with the flu, you have a non-productive cough. You have a cough, but it's non-productive.
Okay, whereas with a cold, it could be a productive cough or a non-productive cough. And usually with allergies, you don't tend to have coughing, you have more sneezing. That type of thing. Now, when you talked about a fever, help people understand what's the usual sort of the baseline for considering a fever, because some people may think 99 is a fever since we're cued into 98.6 is normal. So what are we looking at for fever?
Usually 101 or more for fever, and that's significant, and especially in an adult, that's significant. But I can't stress enough that these symptoms, you don't have to have all of them, but you probably will get them eventually, all of them. But it is a very sudden onset of illness. And last time I had the flu, I was sitting in a meeting, and I said a sentence, and the next time I opened my mouth to say something, I was just sick. And so I got up and left because I knew I had the flu. I could just that quickly.
Let me ask this too, because people may think with the fever, because you wouldn't tend to see a fever with a cold or with allergy, not as much. But with this fever, is this something that you will always get with the flu, or maybe yes, maybe no? Because you did say you don't always have all of the symptoms together. But sometimes people think, well, if I've got a fever, that has got to be the flu.
Well, probably at some point in time you will run a fever, and everybody's not going to run 101 either. And some people may run a higher fever, some of them may run a lower fever. And that again is just our own individual makeup in our immune system.
Now with these particular symptoms, health department wise, how soon do you sort of advise people to go see their physician or a healthcare provider? Is it after a day or so when you're trying to self-medicate and maybe the fever is not responding very well to fever-reducing medications like ibuprofen or Tylenol, those kinds of things? When do you say you should go?
Well, during this time of the year, and I know it's a little early for flu, but since we have the novel flu virus out there, it's not. And I would advise people, if they got these symptoms, to call their doctor. Don't just show up in the waiting room, and see what their procedure is for this, what he would like for you to do. I think that's always the best thing to do, is refer to your own private physician and see how he would like for you to proceed from there.
Okay, that's a good recommendation, because they may want you to do a few things first and see if that's working, or they may want you to do something different, especially like you're saying, if you have some underlying health conditions, they may want to get you in much sooner than you would think they would, to be precautionary.
Some people, I'm sure, will want to see right away, that same day, and others, they don't have any chronic illnesses, or they're not in the younger age group that we're seeing most of the illness in.
Now, with this particular novel virus, as you're mentioning, it's affecting more of the younger age category, those 25 and under. What about the use of aspirin for fever? I mean, we think about Tylenol and other things. Sort of clarify for our viewers this issue of aspirin for children.
Well, you just don't give it to children. It causes something else. It's called Reye syndrome. It can make them very, very ill. And so I think we all of a certain age remember baby aspirins, but we didn't know any better then. So now doctors will recommend that you give Tylenol or something like Motrin, ibuprofen substance for fever. Never give anybody under the age of 18 aspirin.
Right, without your doctor's
Yes,
consent.
yes, yeah,
Definitely
without him
that.
telling you to do so.
Now, in terms of treating these symptoms, because like you said, there really is no cure, we're treating symptoms. So what are some of the things that people need to realize they need to do in terms of hydration and eating? Sometimes a person may say, well, I don't want to eat. Which is more important, to stay hydrated or to continue to eat? Kind of help us understand.
Okay, always the hydration is the main thing. You can go many days without too much to eat and you'll be just fine, but you won't be fine if you don't keep the fluids in there. And so in any kind of liquids, fluids that you can get in, water, sodas, juice, drinks, that we have so many different kinds of drinks now that you know, especially children, you can get them to drink, I think. And you just need to offer them something to drink every 2 hours. And it's not, do you want something? It's drink this. You know, don't give them a great lot to drink. But and even if you're taking care of an adult, it's because you're so sick, you won't ask for anything usually. It's just way too much of a problem to deal with at that time. But the hydration is the main thing. And don't worry if they don't eat for a while, they have no appetite.
Now, you did talk about sodas, you know, soda pop kind of things. People may say, well, hold on a minute.
Yes, I know.
So are you really saying that if all the child will take is something that's the soda pop type, give them that? That's better than nothing?
Yes, absolutely. Well, yes. At least we all know they're getting sugar.
Right.
But they're also getting liquid. And so that is a good thing. Popsicles are great. You know, that would help their sore throat to make it feel better. Just use your imagination. You can freeze Kool-Aid, whatever. But we just have to be inventive.
Okay. Well, what I'm going to do is take another quick break and come back and talk about when people are ill, how do we kind of keep them separate, especially in a home situation, in a school situation, and then look at vaccinations as well.
Sure.
Okay. Please stay with us. We'll be right back.